Welcome, everyone, to the Medicare 101 class. Welcome to Medicare 2020. My name is Mistelle and I work for the Area Agency on Aging. I work in a program called MMAP, also known as the Medicare and Medicaid Assistance Program. And we're going to talk about the basic pieces of Medicare today. So MAP is a program that is designed through the state of Michigan to help Medicare beneficiaries understand all of the pieces that go along with Medicare. So we are funded through grant dollars, excuse me, at a federal level and a state level. So what happens with the grant is each state gets to decide how they want to help their Medicare beneficiaries. So in Michigan, we partner with MAP. We are similar to licensed insurance agents with some pretty significant differences. The differences are, number one, I'm not a licensed agent, but I'm educated in the same fashion as far as looking at options, helping you look at prices, seeing what everything is that's out there available to you. The differences between what MAP does and an insurance agent is that we are free and we are unbiased. So we are not paid based on what you enroll in, and we don't necessarily represent one item over another. We can look at everything. We try to strive to be as objective as we can and help you just know what all this is and empower you to sign up for the items that are going to fit your life best. We cover Berrien, Cass, and Van Buren County here at Region 4. MAP program is the entire state, so we have about 900 certified counselors in the entire state. Excuse me. And that is the counselor that sits with you one-on-one. That is regional coordinator, which is what I do. I not only do one-on-one counseling, but I also recruit and train all of the counselors in my Tri-County area. There are about 16 regional coordinators for the entire state. And we also have a MAP Central, which is a group of men and women who specialize in different pieces of Medicare. So we are going to dive headfirst into what exactly Medicare is and some basic understanding of what you need to know about Medicare. Medicare is a federal health insurance program. It is administered through CMS, Centers for Medicare and Medicaid. Social Security handles the enrollment and eligibility, and all of the rules is handled through Congress and the government. There are 4 basic pieces to Medicare. Medicare in and of itself is not considered full coverage. When you sign up for Medicare or have Medicare, Medicare A is for hospitalizations at a certain percent. And Medicare B is for outpatient services and doctor's visits at a certain percent. That leaves you responsible for the percent that Medicare doesn't cover and all of your medication coverage. To be eligible for Medicare, you need to be 65 years old or older, or if you are disabled through Social Security for at least 24 months, you are eligible for Medicare. These are topics that are kind of specialty topics. I don't usually discuss these in any detail during class because it doesn't cover a wide number of people. But what I have referenced here is the Medicare and You Handbook. And if you need one, you can call Area Agency on Aging and we will get one to you. But these are the pages that reference these certain special situations. So signing up for Medicare. If you are already receiving Social Security benefits, you're automatically going to get a Medicare card in the mail through Social Security with A and B on it. If you are ready to sign up, ready to take your Medicare, you simply keep that card and it's going to have a start date and it'll start on the date that's listed on your card. If you are not receiving Social Security benefits and ready to sign up for Medicare, you do need to take action and either call or get online to Social Security and sign up for the A and B pieces. You do not have to take your Social Security benefit in order to have Medicare. You can do one or the other. So if you don't want to take your Social Security benefit, you don't have to sign up for Medicare. The difference is you're going to be billed at a quarterly rate as opposed to having a monthly fee deducted from your Social Security benefit. You do want to make sure that you understand the enrollment in A and B, and if you really need to, and we'll get into reasons why you wouldn't need to in a few slides. But there can be some pretty significant penalties if you don't sign up for your Medicare when you're supposed to. So one penalty is payment. They will penalize you 10% for each consecutive 12 months that you are not signed up for Medicare when you're eligible to have Medicare. Again, there are certain situations that can offset that Medicare enrollment. You're also penalized with timing. So if you don't sign up during your initial enrollment period or when you should sign up for Medicare, and you think, oh, I missed it, I need to sign up now, there is January through March that you can sign up, and then that Medicare won't actually start until July of the following year. So there could potentially be some pretty significant time frame that you do not have insurance. And unfortunately, the way that it works with Medicare and other insurances is Medicare is primary. And if you're eligible for Medicare, all the other insurances are going to expect Medicare to pay first, and then they will pay after Medicare pays. If you're in your penalty time frame and have signed up January, March, it starts July of that year, so you don't technically have that until July. You don't have that first payer. So that can be a significant penalty. So you just need to make sure that you understand what you need to sign up for and when you need to sign up for it. And that's exactly what MAP does, helps you understand all of this and when your enrollment periods are and what potential penalties you could face. Okay, so this is, in some cases, you do not need your Medicare. And you can, even if they send you a card automatically and you, for example, are still working, your work coverage is considered primary to Medicare, you're not interested in signing up for Medicare, you simply sign and send that Medicare back. You will get Medicare A. In a lot of cases, a work insurance is almost going to require you to keep your A. It's a free service if you have your work quarters, and it helps that employer or group plan save money on your enrollment in their plan. So if you are still working and covered by a group plan that is considered primary to Medicare, then you don't have to sign up for Medicare B or any other Medicare drug coverage. That's going to be covered by your employer plan. When you retire and lose that plan, that is going to give you what's called a special enrollment period with all of the protections, no penalties, to sign up for Medicare at that point. The only piece to that is you are going to need to show verification from your employer of the dates that you were covered while you were Medicare eligible, just to show that piece of paper is what's going to offset that penalty. If you are covered by a spouse's group plan, that is also considered that is also considered primary to Medicare. You can offset your Medicare B and drug coverage. Some retirement plans are considered primary to Medicare. There are a lot of instances where it could potentially be financially beneficial to go all Medicare versus that group plan. And that is something that you can consider and that a MAP counselor can help you look at. We can't necessarily look at the details of your group plan, but we can give you details on Medicare options so you can compare. And sometimes if a group plan is having you have large deductibles and large out-of-pocket costs, we can look at those with you and see what's going to be the most cost-effective for you. Okay, so now we're going to look at the basic options with Medicare. So this is addressing that percent that Medicare does not cover, and then the drug coverage. The first thing I do like to say is that there is no perfect plan. I have almost every day people ask me, well, what does everybody sign up with? What's the most common thing that people sign up for? And that just, there is no one size fits all, unfortunately, with insurance. It's all about your health, your budget, and pretty much how comfortable are you with the unknown. There are some people that would prefer to save all their money and only pay for what they use. But then there are some people that prefer, I want the just in case coverage. It's all about your personal decision. And even to the point where I have a lot of couple counselings where the husband is on one thing and the wife chooses something completely different. It is that personal of a decision. So here are the two Medicare options. You have what's called Original Medicare, which is your Medicare A, your Medicare B. That covers about 80% of your medical costs, hospitals and doctors and outpatients. The 20% is covered by what's known as a Medigap policy, and Medicare Supplement is another name for that. That covers potentially every dollar that Medicare does not cover for your medical expenses. And then you pick up a separate plan known as a Part D or prescription drug plan. So essentially on the Original Medicare, you have 3 separate policies, 3 separate premiums. The other option is a Medicare Advantage plan, also known as Part C. This incorporates all the pieces to Medicare. So your Medicare A and B, 80% is inside this plan. It gives you some secondary 20%, and it usually gives you the drug coverage all in one plan. On this side, you have your Medicare premium and then the premium for this Part C. Some coverage differences. Your Medigap policy or Medicare Supplement is going to absorb deductibles and copays that Medicare does not cover. There are no restrictions on HMO, PPO, or service area. If your doctor or provider accepts Medicare, it's an automatic process that they're going to accept any Medigap or supplement plan that you have. You will need a separate drug plan. None of those original pieces cover vision, dental, and hearing. That does not mean that you cannot have dental, vision, and hearing. It just means that you have to purchase additional policies that are going to cover dental, vision, and hearing. The Advantage plan, again, it rolls all those pieces into one. The monthly premiums for the Advantage are usually much lower, but you always have copays for every service, every doctor's visit, every blood work. There are restrictions on service area and PPO, HMO. Not every provider is going to take every Advantage plan out there. So that is definitely something you need to make sure that you understand as your doctor contract with your Advantage plan. Cost difference. On the original Medicare side, assuming you've got your work quarters and have free Part A, your A will be $0. The going rate for Medicare Part B is $144.60. Again, if you're drawing Social Security, that comes right off the top before it touches your bank account. Then you have a premium for your Medigap or supplement plan. Those can range, if you're signing up at 65 for the very first time, a female can get one for about $90. A male can get one for maybe $100, $105, depending on what type of plan you select. And that's more options we'll get into a little bit later. And then you have your Part D premium and pharmacy costs. Part Ds range anywhere from $13 to $89. And it really depends on which Part D or drug plan is going to cover your medications at the most cost-effective way. Advantage plan, again, if you have your work quarters, your Part A is free. You will still have your Part B premium at $144.60. Then you have one premium for your health and drug coverage, and then you'll have your copays and pharmacy costs as you need them. There is a little bit of a federal tax situation. If you have a higher income, your Part B and your drug coverage will have higher premiums based on your income. If you go from $85,000 to, oops, I'm all the way at Social Security, there is a special form that you can fill out through Social Security that can essentially tell Social Security, hey, I don't have that income anymore. Please don't increase my premiums, sort of situation. They will use your taxes from 2 years. So some people, that's a drastic change. Okay, Medigap plans, supplement plans. The basic benefits is they cover all the copays and most deductibles. They don't cover long-term care, hearing aids, private duty, or prescription coverage. You do have to have Medicare A and B both in order to buy a Medigap policy. These policies are actually sold by private insurance companies. So this is a Medicare and Medicaid assistance program counselors' one weakness. We do not have full access to these plans. We can give you plan options. We can talk to you about all of the different plan types there are, basic cost, the whole 9 yards. The one thing we cannot do is we cannot actually get you enrolled in this type of policy. These private companies just do not give me that hall pass. These plans will cover only one person. So if it's a husband and wife, Medicare and supplement plans are only going to cover the one person. There is no family plan. They are standardized. So the only thing, basically what that means is depending on what type you select as far as your coverage, that is the same no matter what company you get it from. So it's going to cover you the same medically. The difference is what company you go through, some of the additional benefits they will offer you, exercise programs, silver sneakers, you know, discount cards. I had one lady a couple of years ago, she got a grocery discount coupon and saved about $70 a month. So this is a business, and these companies want to offer you incentives to sign up for their company and their insurance. So the actual health insurance coverage you get is the exact same. It's the extras and how much you're going to pay for that plan that is not necessarily standardized. These plans are renewable. So once you sign up, most people sign up for the long haul, and they automatically renew as long as you continue to pay your monthly premiums. There is that one simple rule with these plans. If Medicare approves and pays for a service, this Medigap supplement plan will pay, and there's no two ways about that. These are the different types of plans. This is a federal chart, and it is printed in the Medicare handbook. In Michigan, we usually see A, the C, D, F, G, and N. And if you kind of connect this chart and these options, so for example, the A, that's the basic coverage. You have the 20% that Medicare does not pay covered 100%. No co-pays, no co-insurance. They give you extra blood, and they give you inpatient hospice and nothing else. You would think that that's the cheapest plan, and ironically enough, it's not. But the next section here, nursing home, Part A deductible and Part B deductible, are really what makes each plan a little bit different. So once upon a time, the F as in Frank was the highest insurance you could get. It covered every dollar that Medicare did not cover. However, in January 1 of 2020, the F plan was phased out, and so was the C plan. And the reason is they decided that these plans should not cover 100%. So they have stopped covering your Part B deductible, your $198 deductible for Part B outpatient services annual. So if you were or are Medicare eligible before January 1 of 2020, you could still sign up for an F or a C plan. Anybody Medicare eligible after, those are not options. So currently, the G, as in giraffe, is the highest insurance you can have, and it covers every dollar that Medicare does not, except for the first $198 annual deductible for your outpatient services, which is usually one doctor's visit anymore. You also have a D, and that covers almost everything. You are open to that annual deductible, the $198, and what's called a Part B excess charge. And in this little red square, I've got the definition of what an excess charge is. Basically, what that boils down to is whether or not your provider is accepting Medicare assignment. So Medicare assigns every procedure and everything that you can get done medically a price that they are willing to pay. And if your doctor says, I accept Medicare assignment, they are basically agreeing to accept whatever payment Medicare makes, and they're happy. There is no excess charge. If they say, no, I do not accept Medicare assignment, they will still bill Medicare and accept what Medicare pays. And the difference between that payment and their bill, they will bill you that excess charge up to 15%. So that is kind of where the excess charge happens, is if your provider does not accept Medicare assignment. You don't see them too often. I have been working with MAP for about 7 years total, and I've seen it just a handful of times, and it's always been some contracted person to read a test result. The problem with excess charges is you don't really know when they're going to happen or how much they're going to be until you're looking at that bill. So some plans, the G, covers that excess charge. You also have an N policy. An N is kind of a good, I describe it as a give and a take. It gives you pretty decent coverage, it gives you a pretty decent premium, and it's going to take limited copays. So you're going to have a copay of up to $20 for some office visits. And it's always going to be a doctor or a specialist and emergency room. You're going to have $50. There are a couple of high deductible plans. Again, if you were eligible for Medicare before January 2020, you could get a high deductible F plan. If not, you can get a high deductible G plan. Those plans are based on exactly that, high deductibles. You pay very little for that plan, maybe $40, $50 a month, but you have to satisfy the high deductible of $2,340 before that insurance starts. I think we talked about this already. The F and the C have been phased out. Another note I will say is, if you were eligible before 2020, January 1, it would be a really good idea to look at the cost difference, because a lot of times, and in my experience, people that are eligible for that F plan or that C plan, it is financially a better choice to go with maybe the G or the D, because those F plans and those C plans, unfortunately, those premiums are already starting to increase. So you're going to pay, and I have seen, unfortunately, some comparisons of that F plan being $400 or $500 more in premiums per year, and the only thing they're paying is $198. So sometimes that's not the most cost-effective way. But again, that is something that a MAP counselor can help you look at and decide for yourself. So Medigap plans are enrolled in during your initial enrollment period, which generally happens, it's got a 7-month window. 3 months before your 65th birthday, the month of, and then 3 months after. If you are delaying your Part B because you have an employer plan, your enrollment period will start when you sign up for your Part B. And you'll have 6 months to sign up for everything else without penalty. If you are in an enrollment period, which happens, I know it says it only happens once, which technically it kind of does, it depends on your situation. So if you're turning 65, that's when your enrollment period happens. If you're signing up for Medicare B after being 65 and you're retiring now, that's when it happens for you. During that enrollment period, these Medigap companies, they cannot deny you insurance, and they cannot put any conditions on your policy. If you get outside that enrollment period, unfortunately, that's when health screenings and pre-existing conditions come into the picture. For some people, that's not a big deal, but for some people, that's a huge deal that have significant health issues. And we'll talk a little bit more about that in a couple more slides. Excuse me. Okay. So how does your Medigap plan increase? There are 3 ways that Medigap rates increase. Unfortunately, most are attained age. They are going to increase every year due to inflation, and then every group or handful of years based on your age. They cannot single you out and say, you are now 80, boom, here's your new price. They take a group of ages. There are a few that are issue age, and those are going to increase due to inflation only. Starting out when you're signing up for the first time, the issue age policies will not be the cheapest ones. They're going to start out a little bit higher on a monthly basis than the attained age. Community rated plans, once upon a time, were the best rate. Everybody got the same price, depending on, it didn't matter your age, if you were disabled or not. You picked a plan, it was community rated, boom, here's your price. Unfortunately, there are no community rated plans currently. There is one hybrid. It is the United Healthcare AARP supplement plan. It's a hybrid, meaning it's not a true community rated, it's not a true issue age. So what that plan is it gives you a decent rate, but the increase annually is standard. It's between $6 to $9 in my experience that I have seen. So it's not going to increase a little each year and then a little more based on your age. It's going to be $6 to $9 each year as an increase. So it's kind of a hybrid. It's not a true community rated, but it's not a true issue age. It's not a true attained age. A golden question that I get asked all the time is, when can I change my Medigap policy? And the true factual answer is, anytime your heart desires. A Medigap policy is technically not designed to review and change out annually during open enrollment. Unfortunately, a lot of the commercials that come out during open enrollment time lead people to think otherwise. And you can review that plan. You can see if you can get a better price. It simply falls on that guaranteed issue, which is during your enrollment period, that you're protected. They can't ask you any health questions. They can't use any pre-existing conditions against you or not. If you are outside of your enrollment period and pass that health screening and get a better price, go for it. That's a better price. You have gotten a new policy. It's all dependent on your health. Again, for some people, that's not a big deal. I've had 85-year-old women in my office that has passed the health screening and saved $50 a month by switching. But for some people, that's a huge deal. There is a point in that health screening that that company could say, I'm sorry, we're not going to offer you insurance. So you can technically review that plan anytime you want. It's just a matter of a health questionnaire or not. So when we're looking at the Medicare drug plans, there are different levels of coverage that Medicare drug plans offer. There is a really ugly word that a lot of people get scared about called donut hole or coverage gap. And it's not necessarily anything that you need to be scared about because it doesn't touch and affect every person. So this is a basic illustration of how the stages of a drug plan are set up. So if your drug plan has a deductible, that's the first stage. You're going to pay full price for your medications until that deductible is met. Some plans don't have a deductible. Stage 2 is where everybody wants you to stay, initial coverage. Your medication is covered, you have a copay, and your insurance pays a certain amount. Stage 3 and 4 is where that donut hole or coverage gap come into play. So over here on the right-hand side is my little fish bucket. And you have your deductible and then your initial coverage. When your medication cost, what you pay and what your drug plan pays, your true cost, reaches $4,020, that's when you hit the donut hole. And basically what the difference is in initial coverage, you have a standard copay. Once you hit the coverage gap, you're going to pay a percent of the full cost. For cheap generic meds, that's really not a big deal. The higher cost medications, inhalers, insulins, you're going to pay 25% of the full cost of that med as opposed to a standard copay. Until, again, your total med cost reaches $9,719. And then that percent changes. You are going to pay 5% or $3.60 for generics, 5% or $8.95 for a brand name. If you reach catastrophic, that's usually going to ride you through the rest of the year. As a MAP counselor, I can look at people's drug coverage. I can tell them pretty accurately what month they're going to hit their donut hole, how much those months in the donut hole are going to cost, and then when and if they reach the catastrophic and how long that is. Unfortunately, I have sat with some people that have met deductible, reached their coverage gap, and reached catastrophic in the very first month of picking up medications. It really just depends on your medication list and the true cost of your medications. So now we're going to talk about Advantage plans. A lot of the concepts are the same as far as like the donut hole. You could have those same stages of medication coverage in a prescription drug plan with original Medicare, or the Medicare coverage, the medication coverage inside an Advantage plan. So again, Medicare Advantage wraps all of your pieces into one. You have A, you have B, you have secondary coverage, usually drug coverage. In a lot of cases, especially the newer ones that are coming out, you have dental, vision, hearing. Transportation could be offered in these. Over-the-counter medications can be offered to a certain level in these Advantage plans. You are always going to have a copay. So that's kind of the give and the take. You are saving your money and only paying for what you use. You pay a small monthly premium, and then $20 when you go to the doctor, $60 when you go to a specialist. Just a kind of a guesstimate there. These plans usually do come with a maximum out of pocket. So if something significant happened and you used up all of your copays, let's say you got in an accident of some sort and you were in the hospital and you needed a surgery and then you needed some rehab, you're going to use all of those copays, and those are going to add up until you reach your maximum out-of-pocket expense, and then you pay nothing for the rest of the year. That maximum out-of-pocket expense is a number you should really pay attention to, because they could be as high as $10,000 or more. Just depends on the Advantage plan that you're looking at. You can have drug and health deductibles inside an Advantage plan. And you do want to pay attention to your service area and if your doctor is contracted with that plan. Again, Advantage plans have PPO and HMO restrictions, and not every doctor has to take every one. Once upon a time, if you had a private neighborhood doctor that was affiliated with a big hospital like Bronson or Borges, or Ascension is another one. It used to be that whatever that hospital took, that contracted hometown doctor took, that is not necessarily 100% accurate. That hometown doctor does not have to mirror everything that the hospital takes. When you are comparing Advantage plans, again, you want to be very careful about the coverage details, because you are picking one plan that has multiple pieces to it. So you're not only looking at your health plan, does my doctor take it? You're looking at vision and dental. Does my dentist take this Advantage plan? Does my ambulance service take this Advantage plan? If you are outside of the service area of an Advantage plan far enough, HMOs are almost non-existent outside of the service area. PPOs are a little bit more lenient. PPOs operate on any doctor willing to send us a bill, we're going to pay. But if you're out of that service area, it's up to that doctor to bill. For example, if you travel and you're all the way in Florida with a Michigan Advantage plan, it is up to that doctor that you're seeing if they are willing to bill that Michigan Advantage plan. I have never seen that happen, to be perfectly honest with you. With any Advantage plan, though, you will always have emergency room coverage. So if you are not in the emergency room and you're in Florida and that doctor says, I'm sorry, I'm not going to bill your Michigan Advantage plan, you have no insurance in that office. They cannot pick out your Medicare out of that Advantage plan and bill just your Medicare for 80%. It's kind of all or nothing with those plans. You also want to make sure, again, that your doctors, your vision, your dental, your hearing, all of those services are covered by that Advantage plan. Some people are not doctor specific or dentist specific. You can always sign up for an Advantage plan and call that plan and say, hey, I'm looking for a dentist. Can you give me some options in my area? Excuse me. Okay. Best time to enroll in an Advantage plan, again, during your initial enrollment period, when you are signing up for Medicare for the first time, whether you're turning 65 or you're over 65 and retiring and ready to enroll in Medicare. There are only certain times of the year that you can change your Advantage plan, and it's actually coming up next month. Open enrollment starts October 15th, goes through December 7th. That is the chance and time for people to review Advantage plans and review their drug coverage. If they find a better deal, that's your chance to switch. With Advantage plans, there is an extended period that you can look at your Medicare Advantage plan up until March 31st. There is a special rule that I do like to point out to folks because not everybody knows about it. And it's called the trial right. And it could potentially extend your options with guaranteed issue for 1 year. It basically says that Medicare is going to give you 12 months to try an Advantage plan to see if you like it. So if you are turning 65 for the first time and starting your Medicare A, and you sign up for a Medicare Advantage plan, you can change your mind within that year and select a Medigap, Medicare supplement within that year and still keep your guaranteed issue right. You could also, if you're signing up for Medicare for the first time, the key is you're starting with your A. If you sign up for a Medicare supplement plan first, and you have that for 2 or 3 years, you're outside of your initial enrollment period, you know you're not going to pass a health screening, but you're curious about those Advantage plans because you don't really use your supplement plan all that much. You can sign up for an Advantage plan, try it on for up to 12 months. Within that 12 months, if you don't like it, you can get back on the Medigap policy that you left. So again, it can extend some options and some choices for people up to a year. We're going to talk a little bit about some preventive services. I do like to point out, because there's a lot of confusion on the wellness visits that Medicare covers 100%. Medicare does cover preventive, excuse me, preventive services 100%. It's got to be a preventive under Medicare's description. And there's a lot of ambiguity with the wellness exams. The Welcome to Medicare and annual wellness visits that Medicare covers as a preventive service 100% is not a physical. It's not a touchy-feely type appointment. It's more of a conversation appointment. They want to get your history, your health conditions, your mental condition, your body mass index, you know, your fall risk. They usually will go through the checklist of other services that you should get. Colonoscopy, different cancer screenings, things of that nature. It's not that touchy-feely physical. Now, that's not to say that you can't go to the doctor and have both. The conversation part is going to be covered 100% by Medicare. The physical, blood pressure, you know, I'm listening to your heart, you know, I've got a pain in my elbow type conversation, or physical touchy-feely, that is going to be subject to the 80-20 split. You can have both in one appointment. Some services that are covered 100% by Medicare, there's a lot of cancer screenings. I have a pamphlet in my office. Again, if you would like that pamphlet, let the agency know, give us a call. I've got my contact information at the end of the presentation here, and we'll send that out to you. But it's a really nice one-look pamphlet on the preventive services and some of the screenings and how often Medicare is going to cover that. And Medicare will catch it if it's one day early. And unfortunately, in my experience, I have seen that. Someone goes for a colonoscopy and oops, they were a week early from their last one, so Medicare denied that claim. So it's good, and usually your doctor is going to know and keep track of that. Okay, we're going to chat about Medicaid just a little bit. Medicaid is a program that pays for health services based on limited income. There are technically 33 categories to Medicaid. So as a professional that works with Medicaid and Medicare, if someone says Medicaid to me, I instantly think, what Medicaid are they talking about? Because they're not all the same. All Medicaid categories are handled through DHS. In order to get a Medicaid category, you have to fit into one of the categories. Satisfy, there's always a non-financial, there's always a financial, and then you have to follow the process of paperwork in order to get accepted into whatever Medicaid category you're applying for. There are only a few that touch the Medicare population, and that Medicare population is not just 65 and older. It could also be that person who is disabled for 24 months and is now on Medicare. So the Medicaid that sits with Medicare and acts as a true supplement plan is called AdCare. So you have Medicare that pays 80%, your AdCare Medicaid pays the remaining 20%, and you still need a drug plan. But that secondary Medicaid supplement doesn't cost you anything. If you are over income for the AdCare, the next level is deductible Medicaid, also known as a Medicaid spend down. That generally works as you have a certain dollar amount of medical expense that you have to exceed before Medicaid's going to turn on. And then that spend down amount essentially turns into your copay. And I've got a little example there of Lucy. She gets, her bill is $10,000. Medicare pays 80%. Her Medicaid deductible is $700. She is over that with her bill. Her Medicaid turns on and pays anything over that $700 and leaves her with that as her copay. For people with Medicaid deductibles, it really just depends on your situation. I have seen it work very well for some people, but I have seen it work not at all for other people. With Medicaid spend downs, that spend down amount is a monthly basis. So for the people that have procedures or I worked with a gentleman, he got some special shot in his eye that was like $1,200 a month. Well, he met his spend down every single month, and it was cheaper for him to go that route than any other option because he kept the full Medicaid for everything else he needed. Usually for the day-to-day medical need, it doesn't work very well because $700 is a lot to meet on a monthly basis. So with Medicaid deductibles, you can select an Advantage plan or supplement to go along with that. Honestly, with AdCare, you can select an Advantage or a supplement as well. It just works a little bit different and is almost pushes that envelope into the too much insurance. And if you don't have to pay for it, why would you want to? There is another category. It's not necessarily insurance for Medicaid, but a program that uses Medicaid dollars. This program pays for your Medicare premium. And there's 3 different income levels that will qualify for this program. Again, it's not Medicaid insurance, but it could potentially help you save money on that $144.60 of your Medicare premium. The Healthy Michigan Medicaid plans are not designed for people that are on Medicare. Those plans are designed for people before Medicare or that person who is in their 24-month waiting period on disability. There are some long-term care Medicaid options that we work with not only through the MMAP program, but at the Area Agency on Aging as well. If your person or yourself requires nursing home level of care, you could go into a nursing home that is considered a long-term care Medicaid. The income and assets requirements for that type of Medicaid are much higher than the AdCare or the deductible Medicaid because it's a different category to Medicaid. There are also some other options for that long-term care. You don't necessarily have to go into a nursing home anymore. There are some options that can bring services to you, one of which is done every day through my agency. It's called Michigan My Choice Waiver. And that program has not only a financial criteria, but has a medical criteria. The medical criteria is nursing home level of care. That does not necessarily mean that you are bedridden and cannot get out of bed. There are different questions that they can screen for that through the state. That program will give you long-term care Medicaid and bring services to your home. There is also PACE, which again has the financial criteria and the medical criteria. Waiver and PACE uses the same medical criteria. It's a program designed through the state, or questionnaire designed through the state, I should say. PACE, instead of bringing them to you, they bus you into their facility and you get all of your services there. Your doctors, your pharmacy, daycare, lunch, everything is in their facility. To apply for Medicaid, it really depends on what Medicaid that you are applying for. The long-term care Medicaid, I think, is the one that it has a little bit different of a twist to it. But generally speaking, you can apply in person, by mail, online, over the phone. DHS must assist beneficiaries who need and request help to complete the forms. MAP counselors are also specially trained to help with Medicaid applications. So we're going to talk a little bit about how to save money. I've told you all the ways you can spend your money with Medicare. Let's talk about how we can save a little bit of money. There are a few programs that are designed through state programs, federal programs, special groups that can help people potentially save money if they qualify. So the first is the Medigap subsidy. If you have selected Original Medicare and selected one of these 5 companies to cover your Medigap plan and qualify financially, you could potentially save some money on that premium. These numbers are going to change in April of 2021 because this is done through the Michigan Health Endowment Fund, which is it's a state level group. So it's not necessarily, it's just grant money, essentially. So it's not through DHS, it's not through federal, it's just grant dollars. So once that grant ends, this will also end. And that is another consideration if you're looking at Medigap policies. If you qualify for this, we're going to look at that Blue Cross Blue Shield premium compared to a premium that might be a little cheaper, and then figure out, is it cost effective to stay with Blue Cross Blue Shield knowing you'll eventually lose this help, or to go with possibly a cheaper plan. So MAP counselors can look at that with you, but that's definitely a consideration. Medicare Extra Help Savings Program, also known as Low Income Subsidy, LIS. This is a program that is a federal level program. It's administered through Social Security. This program sits on your medication cost only. And this is going to work with a Medicare drug plan or a Medicare Advantage plan. Any other Medicare coverage you have, unfortunately, does not work well with the Extra Help because there are certain standards and certain things that that drug plan has to have and has to do in order to match with the Extra Help program in the best way. So this program is going to do 3 things. Pay your premium for your drug portion, erase the deductible that comes with your drug coverage, and then brings your co-payments down to $360 for generics or $895 for brand names. So those are the lowest premiums. If you remember, that is also part of the catastrophic. The greater of the two, 5% of the full cost of that medication, or $360 or $895. This one we kind of talked about already. This one's the Medicare Savings Program. This uses Medicaid dollars to pay your Medicare premium. This one also has an asset and financial criteria. And I'm sorry, I didn't mention that for Extra Help and the Medicare Savings Program, it's income and asset. The Medigap subsidy has no asset declaration. It's only based on income. Okay, and I do always like to mention a little bit about fraud. Unfortunately, fraud spends a lot of tax dollars on recouping and investigations, and some simple ways that you can kind of guard yourself from Medicare fraud is to review your quarterly Medicare summary notice. Everything that is billed to your Medicare account, whether you're with Original Medicare, whether you have Medicare and a retirement plan, whether you have a Medicare Advantage plan, if you have Medicare, you're going to receive a Medicare summary notice that shows everything that's been billed to that account. All your doctor's visits, all your x-rays, all your procedures, all of your durable medical equipment, your shower benches, your knee braces, your wrist braces, everything that is billed to your Medicare account will show up on that Medicare summary notice. If you wait for the summary notice, it's quarterly. There is ways that you can sign up online through a My Medicare account, and you can look at your Medicare summary notices as soon as they're processed. If you catch anything that is not correct, the first part is to call the provider and give them a chance to correct it. Because unfortunately, mistakes happen. It's not all fraud. It could simply be user error. Someone typed something in incorrectly. The first stop is to call that provider directly and say, there's an error, we need to get it fixed. You can always call 1-800-Medicare. I've got the number down here. You can call my department, the MAP program, through the Area Agency on Aging, and report any fraud. Another document that you should always look at is your explanation of benefits. I know you're thinking, well, that's kind of weird. You know, I get my medications, there's not any issues. Medication fraud is becoming a really big deal all of a sudden. Pill shortages, they're going to short you 5 and bill Medicare for the, or your Medicare drug coverage for the full bottle. Or there's something called ghost scripts, where they bill your drug coverage for something that you weren't even prescribed. And it's never going to be something that's a huge dollar amount, because you can catch and red flag huge dollar amounts pretty quickly. It's going to be, you know, something that's on the cheaper side. But, you know, by looking at that explanation of benefits and you think, wait a minute, I don't take that. Again, the first stop is the provider. It could just be an error, but it could also be fraud. I do like to point this out because, again, statistics, we're spending $50 billion on fraud, and we need to make sure that we're detecting and reporting anything that we are suspicious of. If you don't know, still call and ask questions. When I counsel folks and I'm helping them look at Advantage plans or supplement plans, I always like to make sure that they understand what bills they should expect. With supplement plans, there is very few bills that people should be getting, but mistakes happen. If you find a mistake or you're questioning anything, call, ask those questions. Don't spend money that you shouldn't be spending if you can avoid it. Absolutely. Well, I thank you for watching this YouTube. I certainly hope that it was helpful for you. I am available for questions or appointments. Give me a call. This is my phone number, 269-408-4354 is my direct phone number. You can also email me at mistelle@areaagencyonaging.org. I'm happy to answer any questions that you have, provide any information. Just let me know what your questions are, and I hope to talk to you soon. Welcome to Medicare.